Assalamu alaikum. Thank you so much, everyone, for attending this probably at the middle of the week, approaching the end of the week. I really thank the efforts and the huge amount of efforts to organize this through the APR department, the alumni, and to the APR department for doing this and for re-engaging with the graduates. I feel like this is a key contributor to the university success is to actually engage with graduates, exchange experience, probably bring the best of the graduates to the people who are involved in the university, either faculty, students, postgrad, undergrad, and I'm very honored to be here. I am a graduate of this great school, witnessing the expansion, witnessing the venues, and how Alfaisal University is renovating itself by the day. It makes me feel proud that I am a graduate. I'm already a proud Alfaisal graduate. But it makes me more proud to see the achievements, to see the impressions that we're bringing. By the way, Alfaisal graduate is completely defined in the market. In the market, it has been the graduate of Alfaisal is completely defined. It has the market looks at Alfaisal graduate as a different calculus in comparison with other institutions. With all the respect, for faculties and from other institutions, but we're Alfaisal. This is us. I intend to make this as an interactive. I'll have some slides to present. I don't want to make the lecture. This is going to be like a 30-minute or 20-minute some sort of the content that I will deliver, and then open it for questions. Excellent to make sure that we have the right engagement and we have the right people in place. Okay. How many students of medicine do we have today in the house? Do we have other than medicine? We can make a report. Do we have other graduates of medicine? So other excellent other than medicine, pharmacy, medicine. Some
already
graduated of medicine. Okay. If I may ask, what are you doing? MashaAllah. Okay, residency. Fine. خلصت residency? Standard residency. يلا خير إن شاء الله. Best of luck. Okay. So that's interesting. Who is actually thinking of pursuing marketing? خلاص انت المفروض خلاص you're in the program. تمام. So كم العدد يمكن 6. Okay. So non-clinical, so you're not willing to work in direct healthcare provision. صح؟ You're making the decision ولا تستنون نواف البالي معكم عليكم. طيب. لأن نواف البالي ما حيبي شيء. نواف البالي حيبي experience his own career path. Like not necessarily that will apply to everyone. I'll share some experiences. I'll share some of the work that we've done.
مشاري ما اسمع حضرت وشو؟
حاوي
بس
I had a question.
ايه
But this does not require you to answer it now, but this is for you to open the limitations of the thinking, right? So usually when we're in medicine, we're confined to medicine or healthcare. I believe we have a pharmacist. Yeah, I think I met you before. ما أذكر طبعا, so I apologize, but I think I met you before. Okay, so one of the issues that we are in the confinement within medicine or within healthcare specialties is that we don't think beyond beyond the boxes that medicine put us into or contain us into. For example, when we talk about career, when we talk about life savings, when we talk about marriage and relationships, when we talk about investment decisions, when we talk about these bigger questions that probably other students or other graduates of other disciplines are far more skillful in these issues more than us. Let's put it that way. So الأسئلة اللي أبغى أسألكم إياها وخلوها في بالكم is that when do you intend to make your first million? When do you intend to have your first gift? مين تبغى تعمل أول investment؟ This is your decision. عشان كده this is your life gamble that you have to pay, right? When do you want to have your first Uber investment, for example? Because Uber is listed in the stock sign. When do you want to make sure that you do something, you start passive investing? Okay. شو علاقة هذا الكلام بالكلام اللي backwards? I think it has a direct link. We will understand it by the end of the lecture, like by the end of lecture or whatever. Okay, so a little bit about who I am. Sure, okay. I think it's working now. Okay. So a little bit on who I am and why I did this, why I made the decision. So I didn't want to get into medicine today. I wanted to study corporate finance. And probably from the looks, I look like a financier because life happened. But I did well in Thanawi, I did well in Tahsili, I did well in Portugal. So I responded to the family's pressure, and then I went into medicine. It's one of the best decisions that they have made, and I will tell you why. When I started في سنة 2014, probably around my fifth year, fourth, fifth year, I started interning at McKinsey & Company. So back in the day, I didn't know what consulting is and what they do and how they operate. And I started interning with them because I needed money, and I wanted to, pay some wicked deals that financial deals that they had. And I started interning in the summer for McKinsey & Company as a healthcare analyst. I did well in consulting. So I worked. So the agreement with McKinsey was to work for 1 month during the summer period. They extended it to 3 months. And then that contract was extended to the 6 months. So I did pretty well financially at that period. I solved all my financial issues that I used to have, and then I was like, can't I do this as a career option? So the moment I graduated, I did my first year in McKinsey & Company as a healthcare analyst, the same position. I did that for about a year and a half. Then I moved to وزارة الصحة. Okay. So I moved to وزارة الصحة. I worked in وزارة الصحة. I worked in the vision realization office. مكتب تحقيق في وزارة الصحة. So at that time, it used to design the implementation of the health reform, the policies that we need to have in place, the initiatives, the KPIs that we need to work on in the Ministry of Health. The initiative that I focused on was يمكن الاختصار هي model of care for نموذج الرعاية الصحية. Back then we started drafting, designing the next model of care that we want to do for our kingdom, including its pathways, including the clinical care. And I did well in that. Dr. Khalid Shibani, Dr. Khalid Shibani was at that time the Deputy Minister for Transformation. So Dr. Khalid Shibani was like, don't you want to do something that is non-clinical? Don't you want to do a master in public health? I was like, yeah, fine. What's public health? And then he started pointing at one kid, and he used to have a board. So at his board, he started pointing at a couple of words that was there on his board. So the couple of words were basically health policy and economics. Like, and getting Nawaf, حرفيا, like I'm quoting, we're heading in that direction. Yeah, of course, we're heading that way. I was like, what do I need to do? You can apply for a master's and then continue your graduate studies in doing health policy and economics. I did that. So I'm making it sound like it's a very simple, but it was a very long process. But I got there and I did my master's in public health, specializing in health policy and economics. Okay, so I graduated from that program in 2018. After that, I worked as a back and forth. Okay, so I worked as a public health consultant for the Gulf Health Council. الصيادلة يعرفوه في Gulf Health Council because it manages the bulk procurement or massive procurement of medicines for the entire GCC countries. Then I moved from the public sector to the private sector. I worked with Nawaf, so I had to engage with a lot of pharmacists, and I had the privilege to work with a lot of healthcare leaders, especially in the field of pharmacy, as an HUR manager. So اسم position طويل health economics and outcomes research manager. كل 10 مرات فوق من 20. I did that for a couple of years. Now I am managing the HNPS sector, or the health and public sector practice in Accenture Saudi Arabia. My work in Accenture right now is around managing client relationships, managing project financing, making sure that we have the right pipeline of business that we can actually do in Accenture. In Accenture, I'm not going to vouch for Accenture here, but the idea is that I'm acting there as a manager. Education, let's do this quickly. So I did an MBBS from Alfaisal, public health from the University of North Carolina. I did also a master's of research management. على فكرة في ناس ما يعرفون هذا الماسترز حتى هنا في الجامعة. It's a new program that opened on 2020. And inshallah by the end of this year, inshallah, ya Rabb, please join me in the make dua for me that I will be inshallah board eligible for the Saudi Board of Preventive Medicine and Public Health. Inshallah. I should put inshallah in between brackets. طيب. So let's delve right into it. So what are the opportunities that you're going to have if you decide to go on? One disclaimer that you need to put here is that what I'm pitching here is that if you're willing to work on non-healthcare, then that's not the place to be. Then that's not the place that I am vouching for. So what I hated during my medical school, and I regret saying that because this is what I felt back then. But I didn't realize the value of medicine back then. Like what I have done, that I wanted to stay in healthcare, but leave the clinical job. So I wanted to do everything except direct healthcare provision. Or make patients face-to-face meeting or interaction with patients. But I wanted to stay in healthcare because I studied for 7 years and I did a master's. I did a lot in healthcare that they can contribute to given my non-clinical experience. Right? So this is what I'm going to be talking about. This is the opportunities that I'm going to list here. Whether in the public sector, in the private sector, I believe in the private sector because I'm very biased. But I have to sound impartial to you. I am bringing the public health sector experience. Okay. I think my wife is watching us, by the way. But please, let's give her an ovation because she's that's what good mom. Let me do this. أحسن كده عشان to make sure that we cover everything. Like, so from the public sector standpoint, you have multiple options that you can do as a physician or as a pharmacist or as a health sciences graduate who is interested to pursue non-clinical. The first option is working in the Ministry of Health. So Ministry of Health, as we all know, is the main driver of the healthcare transformation across Saudi Arabia. يمكن أحكي قصة صغيرة هنا, which is now the idea of the transformation is based on one simple idea in healthcare. Like one simple idea, كل ما تبحر فيه هقول خلاص. يعني في ناس كثير ما هي قادرة تشرح تحول بكلمة واحدة. طيب كيف تشرح تحول بكلمة واحدة؟ بالصحة. Separation of roles. Okay. So the Ministry of Health used to do the three roles of providing public health. Used to provide the services and pay for the services and govern the services. طيب. This will change, or this is already changing. So وزارة الصحة is not providing health services now. It is provided through the health clusters, and we will talk about them in the next sector. وزارة الصحة is not paying for the healthcare services. There is a new payer entity that's called برنامج الضمان الصحي وشراء الخدمات الصحية. Purchasing and Health Assurance Program, which is going to be the Center for National Health Insurance. So basically, all citizens will be covered through an insurance scheme, and then وزارة الصحة will be the entity basically that is regulating and creating the policies, making sure there is in compliance to these policies, and following up on those elements as well. Like, so in وزارة الصحة, again, there's a lot of work that's happening around different sectors in the Ministry of Health. So the first one is the health holding company. Health holding company is the one entity that is managing health clusters. تسمعون عن التجمعات الصحية؟ تسمعون عنها صح؟ في تجمع في الرياض، في تجمع في الشرقية، في 4 تجمعات في الرياض، في تجمعين في الشرقية، في أكثر من تجمع. So those تجمعات are going to be providing the services in an integrated way. So primary care will be integrated with secondary care, will be integrated with tertiary care. I know Dr. Abdulkarim disagrees a lot with that. Fine, and he probably doesn't see the integration now because still we are in the beginning of the process of the transformation. So that will take time. يعني أنا أتذكر في أحد الاجتماعات مع أحد القادة في الوزارة ما كانوا يتكلمون عن مستهدفات 2030، كانوا يتكلمون عن 2035 و 2040. So that will take time. Okay. ما أعرف إيش بتصير 2040. I don't know. طيب يمكن أنا أكون أستاذ في الجامعة. لا قدر الله. طيب. So the first one is health holding company. They're hiring now as we speak. They're hiring project managers, initiative teams, and they're hiring policy and governance managers. The Ministry of Health as well. It has the برامج الصحة العامة, public health programs. So برامج الصحة العامة, they're looking for program administrators and project analysts. By the way, the opportunities that I'm presenting are not limited to Saudis. So I want to make that disclaimer as well. All right.
because there's a lot of my colleagues who are non-Saudis and they're working in these positions and they're doing extremely good job. حتى some of them are Alfaisal graduates as well from the College of Medicine. Okay, the second pillar that we're talking about is the health clusters. The health clusters or the جماعات الصحية, they're focusing a lot on public health and focusing a lot on prevention. So they're hiring a lot of health coaches, health educators, people who are working on implementing health campaigns. So if you are that MSA guy who always organizes campaigns, think about that. If MSA طبعا not Student Association, فهذا abbreviation يعرفونه طلاب الناس. There is also people who want to be engaged with patients, but they're not basically prescribing drugs or doing clinical work for them, which is basically new roles that will be created by the health clusters, which is the care navigators or some care coordinators. Everyone will have like 100 patients who will be following up their care plan in their primary care in assistance with the family physicians. قريبا ما اعرف ايش الوضع يعني كل تجمع له طريقه تتعامل معها. تمام. في قطاعات خارج وزاره الصحه يسمونها بالعربي الجهات الشقيقه. او sister health entities. Sister entities, either they're entities coming from the stem of وزارة الصحة of the Ministry of Health, or they can be newly established initiatives that used to be in the visualization office and then spin off to their separate entities. Okay. For example, Saudi Institute of Saudi National Institute of Health, Saudi NIH. People of you who are interested in research, they're doing a lot of the SNIH is hiring a lot of research managers. They're hiring a lot of grant specialists as well in the Saudi NIH. You have the Council of Cooperative Insurance. كان اسمه مجلس الضمان الصحي التعاوني بس تغيرت من مجلس الضمان الصحي so to handle the entire insurance sector in Saudi Arabia. They're hiring policy specialists, especially people who have masters, especially health science graduates who have masters in areas like policy, in areas like governance, in areas like fraud detection and insurance. الجماعة حقين مجلس الضمان الصحي. And I spoke actually to one of those. I spoke to one of their executive directors yesterday, and he confirmed that to me. And حتى Nawaf Albali, if you want to join me, I love the part. Non-health entities. I've seen physicians working in وزارة البلديات, for example. It can sound weird, صح؟ يعني ايش دعوة طبيب بيشتغل بالبلديات, بس the idea is working with the public health directorate in the Ministry of Municipal Affairs as health inspectors. They're working as compliance specialists because a part of the job of وزارة البلديات is running around or inspecting the restaurants and cafes and making sure that they're compliant with the regulations, especially the environmental regulations and the food regulations. Okay. There are also positions that I have seen in Ministry of Electricity, Water and Agriculture, وزارة البيئة والمياه والزراعة, as public health specialists, mainly working with the should I say this or not? Let's say it. One of my colleagues is handling one of my colleagues is handling أسواق الإبل اللي موجودة تحت شرف وزارة الزراعة. As a public health specialist, he is a physician. He did a master's in public health and he joined وزارة الزراعة. He's actually مبتعث من وزارة الزراعة. Okay. ممكن سمعتوا عن سبورتس فور اول فيدريشن اتحاد الرياضه للجميع. برضه they're hiring event management specialist. One of my colleagues, she's doing a lot of work with that. So. Okay, so let's come to the private sector, the sector that I'm more biased into, and the sector that I feel that there is a lot of movement around, especially at how quickly they can hire and how flexible they can be in terms of hiring Saudis versus non-Saudis, and how much they incentivize good performance. So if you are performing well in the private sector, that means you're generating a lot of income. Then that means you'll have a better bonus or you'll have a better pay. So if you're thinking about pay, or pay is one of your let's say major criteria, think about the private sector. Okay. It starts with healthcare consulting, which is basically the pillar that I am working on. The healthcare consulting now is booming big time, because there's a lot of need that is being driven by the government. Also, I have seen a consulting need that is being driven by the private sector as well, by Dr. Siman Khalid, by Faqih, by those major players in the system that they want to transform, they want to build new products, they want to position themselves differently, so they need consulting experience to actually help them do that. So who is hiring in healthcare consulting? PwC. So the MBB, they're all hiring. I'm checking the link. So the McKinsey company, Bain, and BCG hiring big time. The Big Four is also hiring in terms of including the Big Four, they're accounting firms, right? Why do they want to actually indulge in healthcare? Well, first of all is yes, they are accounting firms, but healthcare as a market is it's a high expenditure market, and there's a lot of investment. There's a lot of investors that are coming in healthcare, especially in the Gulf region, and they want to realize that opportunity because they see the deficit that we need. We need physicians, we need hospitals, we need primary care, and the better investor who can come in early and capture that investment and capture that return on investment. So the Big Four, they have health divisions within their practices. Accenture doesn't only have a division in healthcare; it has a whole entire practice that cuts across all their industries that they're working on. So they're working on technology, advanced emerging tech. So technology and emerging tech and strategy and consulting, all they have healthcare. So in Accenture, we work a lot on artificial intelligence, machine learning models, in collaboration with our healthcare clients. One of the sectors that I love, honestly, is pharma. I love pharma because I worked on it. But the way it is transforming, the way it is redefining itself is impressive. I had the chance to work in Novartis, and I have seen the transformation hands in hands, where they transform themselves. Pharma used to be sales and marketing, especially for people who don't know about pharma. It used to be sales and marketing, so you have the drug, you register it in the Saudi FDA, and then you push it to the market. Yeah, the role isn't as easy as it used to be. Now you need to actually partner with the healthcare system, address their needs, see what they have exactly, what they are suffering from in terms of patient compliance, in terms of prevention, in terms of patient education, and then push your drug as a solution. So I was part of that adventure with Novartis on their multiple portfolios
of drugs that they have pushed into the market. So that was an interesting, very interesting experience for me. Why they are hiring physicians? I think there are key physicians now. Basically, they want to partner. And I can mention some names. في دكتور هاني هاشم, he's a senior oncologist. He was in تخصص لما he is now the senior medical director in Pfizer. So he's the medical director in Pfizer. Medical director is a big for people who don't know pharma, medical director is a big position in pharma. Dr. Amun Abed, she actually taught us in neurology, and she is now the medical director in Eli Lilly. You probably want to consider that. So they hire in the medical departments, and they hire for research positions. Now, pharma is being asked to invest a lot in research, to invest a lot in localization. So, if you are a physician and you have experience, plus or minus a certificate in research, look for pharma as an applicant. طيب.
For pharmacists, this is for pharmacists actually,
but I'll say it anyways. Now the government of Saudi Arabia is looking for local manufacturing deals. So they're not buying the drug, and that's it. What they're doing is that they're buying the drug along with the technology being transferred to the Saudi manufacturers. على سبيل المثال أنا عندي دواء كوليسترول جديد. أبشتري منك أنت يا فايزر على سبيل المثال. فايزر ما عندها دواء كوليسترول بس أنا بقول كان عندها قليل بس أنا فعندك دواء كوليسترول جديد مثلا. تعالي يا فايزر أنا بشتري منك هذا الدواء. لكن on the other hand, you have to collaborate with a local manufacturer in Saudi Arabia, let's say Sudair Pharma, and teach them how to do that drug. So that is the local manufacturing roles. So I've seen Sudair Pharma and other local manufacturers are hiring for local manufacturing roles, especially في الناس اللي مهتمة في البيزك ريسيرش، الناس اللي مهتمة في السبلاي تشين of how it can be done. I've seen that in terms of their hire. The other industry that I have found people working on is health insurance. And health insurance, you know why people would be interested to come into, especially physicians. Why physicians are working in health insurance. Part of it is as a health insurer, you need physicians to actually tell you whether to approve or disapprove a certain claim. So you know what the claim is? The phone claim. ما نعرف claim عادي. الclaim is basically if you request بالضبط ليش بشرح هي فعلا request. فالrequest comes from مثلا سيمان الحبيب, it goes to Bupa and then Bupa approves it or disapproves it. In that request, you will see the patient history, you will see the labs that are being confirmed, and the labs that are being requested and the medications. So all of that will be in a piece of paper, which is basically a patient record. How we call it a claim in the insurance industry. Who will approve or disapprove? Should we pay for the claim or should we not pay for the claim? Who will make that decision? Probably a nurse plus physician. Like some insurance companies will. How can I say this without being so? Some insurance industry will actually cut the cost and hire low cost people to make sure that the medical approval happens. But now with the new regulations, they have to hire physicians and pharmacists to actually approve these claims. So you will find a lot حتى ابحثي مثلا medical approval or medical approval in the insurance industry. You will find a lot of those companies they're posting jobs and you can basically apply for them. The insurance industry is now going big with the billing and coding, especially with the drive that is coming from the Council of Insurance, because all of bills need to be standardized in a certain way. They need to be reported in a certain way, not necessarily the prices within the prices of the healthcare services, because that will differ. based on the clinical experience or based on the provider or based on the consultant who's treating you. So the way you will be charged could be different, but the way you should report these charges should be standardized. So billing and coding is big. So if you are a physician and you want to actually have a quick job, go do a certificate in medical coding and billing. So that will hire you immediately tomorrow. Sorry. There is another sector that's interesting, and I invite you. I hope that one of our friends who was working in revenue cycle management actually joins in. There is Dr. Alfaisal Alumnus. He is a graduate of Alfaisal and he works in one of RCM companies. It's called Acumen. He works in Acumen. So what they do is that what is basically revenue cycle management? It's basically the software that sits in the middle between the provider and the insurance company. So if Bupa wants to collaborate with the relief, they will hire an RCM provider to actually make that connection happen smoothly in a way that's automated. RCM now is going big, very, very big in the private market. The one signal that was interesting to me that وزارة الصحة is hiring RCM companies. But بتقول لي وزارة الصحة doesn't deal with insurance? It doesn't, but it will, right? At some point, وزارة الصحة will deal with insurance. So RCM companies are getting the signal that Ministry of Health might be interested to actually play the RCM game with them. So that will boom the market. We'll wait to see the signal and what happens, but that's interesting. Okay. So I'll get to some of the interesting stuff that Okay. So how your career progresses, I'm gonna do this quickly. So you start as a junior, so similar to the medical residency, but with different responsibilities that can happen. So you start as a junior. Your stakeholders are mainly internal, so you would report to a line manager, and that line manager tells you basically what to do. He guides you through the process, and you're not going to be working a lot externally. So you're not going to be looking after clients or talking to clients. The moment you grow, you will start to externally face customers. You'll be starting to deliver speeches, give recommendations, give some sort of advices to the client. It starts, so the capabilities, so that's the stakeholder. The capabilities, the way you start with it is that you start with working on tasks, right? So you start managing you start managing assets with your project, your deliverable that you need to deliver, collaborating with different departments. In pharma, for example, you will collaborate with medical, or the market access, or the sales, or the marketing. In insurance, you will deal with a lot of those as well. And you will be the owner of your work, the owner of the intellectual component of your work. So if you've done an analysis, for example, it will be your responsibility to ensure the integrity of your analysis and the validity of your analysis, rather than the responsibility of your senior. Your senior will see how it is presented and how it can reflect on the client itself. As you move forward in your career, you will start managing people in the difficult part of the job. Because I am a recent manager, so I can feel it. So I start managing people. There were 6 people basically who report to me, managing the project finances, and basically be the person who is accountable for the client interaction. So the client doesn't know Accenture. The client doesn't know Nawaf Albali. And if Nawaf Albali screws up, then the client will think Accenture screws up. So that puts a lot of responsibility as you grow up. This is where you reach as a manager. And what gives, but as your career progresses, you will be a manager of managers, and then a manager of executives, where you become the C-suite. You can the C-suite. I am a recent manager, so I can't talk. يعني ممكن أقابلكم بعد 10 سنوات وأقول لكم what's the experience of being in a C-suite in a C-suite position.
Okay. I'll do that very quickly. طيب. Is non-clinical for me? Is it not for me? As I said in the beginning, it's your decision that you need to take. But the benefits that I have seen is one, the training and the counseling opportunities that I have received. Humongous amount of training. I have received a lot of. I have interacted with senior executives, so I've had many one-on-ones with seniors in the field, and I got to understand how they think, how they talk, how they present themselves, how they wear, and how they can handle stressful situations. So that transformed me in a very, very, very big way. The other thing that I have found is that my colleagues who are residents in the same batch, يعني لاحظت عليهم سواليفهم doesn't معلش يعني أنا آسف I have to say this. Like, they don't have a wide scope in terms of discussion. So they only talk about on-calls, patients, and treatments. Okay. This is if I can bucket it in 3 buckets, this is the bucket that we talk about. In my career, I feel like I've been lucky, and probably Ahmed Khalida is on the Zoom, can even shed the light on that. I've been lucky to work with lawyers, accountants, finance experts, executives, marketing, business development, sales. I've interacted with all of those people, and they give me a lot of perspective, a lot of different views on how they address a certain problem. So that helped me a lot in shaping my skills, basically. So I've met with I remember at that time when I worked in the Gulf Council, I met with the Minister of Health in Oman, in the Sultanate of Oman, and one of he's a funny guy, Dr. Ali Saidi, and when he's a rheumatologist who left medicine. So he does not practice. He's basically the minister. And he was like, Nawaf, when are you joining your residency? Residency is basically our medical training, postgraduate medical training. I don't, respectfully, sir, I don't intend to do that. Why? You are a rheumatologist and you left your job. Why didn't you continue to be a rheumatologist? He was like, that's a very intelligent answer. It was logical to me. He was like, one of the regrets that I have made is that I didn't try non-clinical early in my career, because he right away came from the clinic right away and he became the minister. So that's one advice I can give. Challenges. I don't see challenges صراحة, but I put it there because I want to sound unbiased and كشخة. But I don't see the challenges. Things that I have mentioned in the slide is the dealing with the uncertainties, and that happens in all aspects and elements of life. And the other thing is that I have found a little bit difficult is adjusting with the corporate environment. So all of our training in medical school was in hospitals. So we did not work in corporates. We did not work in. We did not. We were not trained to actually talk about one thing 100 million times to different stakeholders. For example, we give the order and that's it, right? In the medical field. Collaborating with different departments, with different stakeholders, understanding the internal stakeholders in the corporates. So that was very, I would say, interesting challenge that I had back then. Okay. You want me to talk about pay? That's interesting. الشباب قالوا ايه الباند ولا لا؟ هذا my epidemiology mind. I'll talk about it definitely. Yeah. Okay. So recommendations, very. I put some recommendations that I feel are very relevant for people who are recently graduating or have already graduated. Start early on. Start early on. Anyway. 20, 29, 30. You're fine. Like, so make the decision early on. حتى if you so if I'm talking to university students, make it a habit that you try different things early on in your life. In your 20s, and you are a highly sellable commodity. Like, so you need to try different things and see what connects with you, what makes you feel more content, what makes you feel more towards achieving your goal or achieving your purpose that you want to happen. Okay. The second thing is build a lot of network. Talk to people, get to know people on the personal level, and the way you do networking here in Saudi, okay. What I have noticed that the way people do networking is that I'm not going to criticize, but it doesn't feel like it doesn't feel genuine, right? It doesn't feel like there's a personal connection that's happening between two people that are doing something. It feels like we want you to know, we want you to connect us to the right people, and then they will forget about you, for example, if they're looking for a job. Make sure that these networks, especially with senior colleagues, that they are personal. You're talking about their kids, you're talking about their recent trip that they took to the Bahamas, and you will have a lot of networking opportunities. So please, I cannot emphasize on that. I cannot emphasize on that even more. So that is the third one is about pay. But I'll talk about pay in a different manner. But the way I want to talk about it is that this is my last slide, by the way, so prepare your questions. So, pay gets better. So what I have seen with my colleagues who are, medical graduates and they have done a master. So let's say they entered the non-clinical job. They had a job, for example, to work as an executive assistant, for example. I'm just giving you an example. Pay gets drastically more. And drastically, I'm talking 100 to 150%. Gets drastically more if they have a master. Okay, if they have a master in MBA or an MBH or an MHA. MHA or healthcare administration. Why? I don't know, but this is a trend that I have seen. Probably the fact that you're a physician and you have a master makes you more credible. I don't know why, but that's how it is perceived at the corporates. So if you can have a master, if you can think about doing a master's, that will be an added value to speak, a strong added value. If you can't, you have any issues, you have family, you have financial issues. I used to have so many financial issues, still do, but yeah. But the idea is I couldn't have done it without the support that I got from Dr. Khalid Shimani at that time. So that's fine. If you can't, then that's fine. If you can, that will be good. The other tip that I can give: try it first. You talk to some people like me, and there's a good number of people who are Alfaisal graduates, and they are doing that. There's a good number of us out there. Reach out to us and probably try it. See if it fits with you. See if that's something that you want to explore, you want to push further, you want to make money out of. You never know what opportunity arises, but try it first. Especially if you have time. You're in the 5th year, you're in the 6th year, working on your licensing exams. Probably try it for 3 months and see if it works with you or not. I've seen some of those graduates who come to us, we train them, and they are bored
from the first week, and this is basically a waste of time and a waste of money for the students and for the company that is training that student. However, you might want to try it for longer and see if it works. I would really push for that advice as well. هذه آخر واحدة. Negotiate يا جماعة. So if you have an offer, if you have an offer, and it is your first offer out of college, it's very hard to negotiate. Very hard to negotiate because basically you don't have leverage on the recruiter. But the further you go in the career, please learn how to negotiate. It's an advice, and I used to be that person who is إن شاء الله يعني كنت صراحة طيب اللي يرضى وكذا يعني الحمد لله وكويس وكذا تمام which is good هذا it's a good attitude. But I learned the hard way that the more I negotiate, the more I'm respected. And the more respectful the more respectful I am in my negotiations, the better opportunities I get, especially when I am about to be promoted. So think about that and learn that skill early on. المشكلة احنا في القطاع الصحي يعني متعودين على السلالم الرواتب ومش عارف ايش. فusually the salary is fixed. لا في القطاع الخاص it's another issue. All right, thank you so much. Wow, it took me all that time. Please, I'm very honored to actually have delivered such a lecture or such a talk. Please reach out to me at any time you are in doubt. I have done a lot of counseling or meetings or one-on-ones with many other medical graduates, and I've had the pleasure to actually share with you some success stories with medical graduates, either from Alfaisal or from somewhere else. Please reach out to me at any time. I'll be very happy to actually counsel you through this, well, given my very little and humble experience. Take them after. Q&A, John. Go ahead. في microphones نعطيهم إياها. No. Your name. Okay. College. First year.
So, how many of these jobs require an MD or an MBBS, and how many would prefer it rather than require?
Require, I'm not sure. Prefer all of them. I'm not sure if any of those require you to be a physician, meaning that you have to have a practicing license to actually apply for those jobs. I don't think that happens, right? So they would basically, when you apply to them, they're not going to tell you where is your practicing license. It's out there, for example. No, they're not going to say that. If by require you mean that it requires a valid license, right? Then I would say prefer yes, because it positions you in a different way in the market. So first of all, you're a medical graduate. Like that by itself is a plus. Another plus is that you're a Alfaisal graduate. Because let's say it in a very explicit way. Alfaisal graduates are treated differently in the market. Right? Especially at consulting or the PIF, for example, or other regardless of their nationalities, they know where we come from and what kind of training we're exposed to. Kareem,
describe it's called the deal breakers that would be certain that will not fit for the job. For example, is the workflow too dull? Is it not rewarding? You feel like the work is not appreciated or has a visible outcome that you would feel as a reward compared to a clinical practice?
Can you repeat the question?
What would be deal breakers that would compare the corporate job for a medical professional that would steer you away from going to the corporate world, such as maybe it's just endless work, it's all paperwork, there's nothing
For Nawaf,
engaging.
in general?
Let's say in general, around the areas I pointed out, if you can read.
Well, that's an interesting question. I'm not going to say a deal breaker because life has many uncertainties. But what I like about being in the corporate world is that the higher the performance, the better the incentive. Okay. I am someone who works hard. For reasons that I come from a middle family or a lower middle class family. We used to work hard. This is something embedded in our DNA. We are people who basically do the job quite perfectly with high quality, right? So if I am incentivized for that, then I'm completely all in for that. The second thing is the opportunities that you're gonna get beyond the incentive. So incentives are good, are fine. They're gonna make you have a certain lifestyle. But there's something wider than this, which is basically the training opportunities, the exposure, the travel, the amount of travel that you're gonna make, the amount of people that you're going to learn from their own experiences. Because one comparator that I can focus on here, I'm not gonna say it's a deal breaker again. One comparator is that in residency, I'm not here disqualifying residency, what have you. But I'm saying, who is your peers at work? Like, they are people who are similar to you, like similar to your experience, similar to your exposure. Probably you're graduated from the same college or from the same college from the same country of that college. Like if you work in the corporates, it's a completely different environment. So you're probably someone next to your office is someone who has 20 plus years of experience. And he has 3 masters. One of them is in data science, and he is working on Python to develop the next programming algorithm for detecting sepsis. And I'm referring to someone here صراحة. فهذا يعني it's a huge asset that can be added to my network, right? And I network with him quite intensively at the end. So the amount of again, it's not. I cannot pinpoint one factor that will tell me that this is a deal breaker. It's a multifaceted kind of answer that I have. Did I answer your question?
Yes, you did. Shukran, Steven. Just another question. Should be simpler and quicker. How would you compare the amount of work per week as a corporate person in comparison to, let's say, a family physician who, for clarification, works 5 days a week, 8 hours a day? And do you carry any work outside your office, weekends, at home, overtime, not paid or paid? Thank you.
Right. I should have put that in the benefits. A better, let's say, better work-life balance. So this is what I have seen in the corporate environment, that there is a better work-life balance in comparison with any medical specialty, be it finance. And finance is not. It is not as it is promoted in a way that this is a work-life balance. I don't think so. I don't think that's true, because the residency training is demanding, and the demands that is non-clinical after you graduate from residency is higher now. They have to report, they have to document برنامج مكافحة العدوى، برنامج مدري ايش، منصة يقين، حاجات غريبة عجيبة they have to work on, and it constitutes they constitute a lot of the time. So I would reconsider family physician when I knew about these things. Okay,
So would you recommend pursuing certificates on the side other than master degrees to post a CPA and help smoothing the transition from medicine to the corporate field? If so, can you give us an example? Wow, that is actually a brilliant idea. I wish I have done it. Is to actually have is to be enrolled in a certificate program. It depends on your interest, right? So if you are interested in public health, you can go to, for example, some of these what you call it, MOOCs, so Coursera and edX, and you will find a lot of certificate programs in public health that can help you transition very well. For example, policy, healthcare policy, epidemiology, public health practice, things, what you call it, biostatistics and data analysis, all of the data science in healthcare. How can you work on AI and machine learning models to help solve a healthcare issue? Because that's coming, and it's coming in a very big way. So these certificates are very important. If you are transferred to the corporate field, does the medical license exam matter? No, it doesn't. Does the corporate field care if the graduate is licensed? No, they don't. If I can put this in a very I am licensed, by the way. And I renew my license every 2 years. It's a waste. I just do it for the sake of me doing it. I'm just doing it because my mom wants it. Right? My mom is a physician, by the way, that's why she's confined to the limitations of medicine. Okay. Yeah, because if you're working as a medical director in Pfizer, what is the idea of the licensing exam? Or having a license? What's the idea? It's for you to practice the profession. صح? You are a medical advisor in Pfizer. ايش حتسوي؟ That's clinical. Not gonna do anything that's clinical, right? You're not gonna be interacting with patients. You'll be interacting with physicians, right? You'll be interacting with policymakers, with ministers, with what have you. But you're not gonna be talking to patients. You're not gonna prescribe, for example. Right? So. I wish nobody asked that question. أنا عندي I have an opinion بايخ أقول كلمتين. I'm not gonna say it on stage. But what I'm gonna say on stage is first of all, depends on the board. Radiology, big board to have these days. ليش؟ Radiology services are being privatized. So congratulations. تعيشون فلوس واجد. Right? And now it's being handed to the private sector. Part of these services, نقول لك X-rays or CTs, they're not complicated, non-intervention. صح؟ فهذا بيكون شيء جيد تعال. I've seen, I might put on the list. I have seen Zaman Habib, for example, hire for radiologists to actually operate a radiology company that I don't know. For people who actually operate the radiology services. على سبيل المثال, during COVID, what happened in the ICUs in the Ministry of Health is that the capacity of the ICUs has reached to the maximum. How did Sulaiman Habib help وزارة الصحة? Is that they started pushing the Ministries of Health patients to actually do the radiology tests in, especially in the ICU, in Sliman al-Habib, and then وزارة الصحة will pay the report. Okay, so it wouldn't pay for the entire life cycle. يعني مثلا transporting the patient and then admitting the patient and then preparing the patient and then reading putting them under X-ray. لا, it will only pay for the report. Cost effective للوزارة ولا لا? Right? بس and يعني on the other hand, the market hasn't picked up that signal because وزارة الصحة didn't follow on through it because it was for a short period of time. It was a model that has been tried, but it did not expand. Would it expand? يلا عليك. Yeah.
Actually, radiology itself as diagnostic, it's not overall for higher education. So, physician can take something, can take so the amount of time spent is already paid. So it's not like surgery when you only have like 5 or 6 surgeries per day and you can go. So it is hard.
It is definitely. I'm not gonna let's say discuss radiology specific issues now. We might follow on that on a different occasion, but it's very. Would it give you a jump start? Of course, and radiology now is being privatized, so that is a peculiar case.
I will continue.
You do continue clinical, of course. See, and that's a. Okay, we're not talking about doing non-clinical here. You're talking about doing clinical but in a different sector. صح? That incentivizes you in a different way. That makes you try new technologies in a faster way than in comparison with وزارة الصحة with other governmental sectors. Because the private sector, باختصار, they want to have more volume to generate more revenue. So they will try everything to actually do that, and they will invest in technology stuff, right? So that is the thinking that I wanted to have as a radiologist. But yeah, promising field. Applied medical science, essentially medical laboratory students in the private sector. Well, I don't know because I haven't worked on in the lab industry. I know it is booming for one reason, that we're heading towards home care and we're heading towards telemedicine, and that means that we will have higher numbers of lab tests being ordered by physicians. But I don't know because I didn't work in the sector. I can't say that I know it very well. But if you are a medical laboratory student, for example, you would want experience working with laboratory information systems providers. اللي هم LIS providers. الحين لو في حد في الميديكال لابوراتوري بيعرف ايش قاعد اقول اللي هي LISs laboratory information systems اللي هم كان اسمهم care I forgot the name, but there's a major LIS provider that is hiring. But because I feel like technology will definitely disrupt laboratory sciences in a big way, and the way we do the testing and the way we do supply chain and the way we do a lot of the enablers for the laboratories. So I would advise you to Google LIS or laboratory information systems, واكتب جنبها vendors or providers. راح تلقى list الموجودة في السعودية, and you can probably talk to them and be advised to work with them because they hire laboratory. You are a medical laboratory graduate, so that is your discipline basically, and that's your industry. Okay.
From what I know, at least in the Asian region for academia, an online degree, whether it be a master's or a course, might be looked at sort of in a negative light, that has lesser value than physical. For instance, you do you think that that's the same case?
Exactly. So I'm glad that you mentioned the last couple of words. So the corporate sector. For the corporate sector, how do they define someone's eligibility to have an interview? I'm getting you back a little bit. Yeah, let's take one step back. And what is the criteria that they're looking for in the corporate sector? رقم واحد major يعني it doesn't apply for each and every industry, but let's say there's a ranking. Like one, experience. Okay. Experience number one. Number two, qualifications. Like you will tell me the qualifications I had an online degree. So by the way, my public health degree is online. Okay. And no one made that comment to you at any time, but the corporate sector in specific doesn't account for the degree being online versus physical, as long as you have the right experience utilizing that degree. Wow, is that clear? So I have a degree in public policy, in health policy. Okay. It doesn't matter much where I got it from or how I got it from, but it matters that I have met ministers of health and I contributed to health policy discussions at some point in my career. That actually weighs in way more than the degree being online versus physical, right? I'm talking about the corporate world. I'm talking about multinational corporates. Maybe not necessarily the national ones, because the national ones are still picking up on that phase. Because now we have millions of people coming up with online degrees, so the market is picking up on those graduates, and they're coming to the market and they're proving themselves and they're proving their worth. Did I answer your question?
One question I have, you also mentioned about I guess the huge wave of data science and AI and machine learning.
Right.
What role do you think that physicians have to play in that?
Oh. So AI will not replace physicians. Let's start with that fact. Not at all. Not at all. For one reason. We should be looking to AI and machine learning as decision support systems. What do I mean by decision support? It will help me. So the model, the algorithm itself will help me make the right choice for the right patient at the right time. Like it can help me make the right choice, but maybe not the right patient at the right time. AI did not reach that level of singularity where it can actually make that decision in a wise way. Hikmah, let's say باللغة العربية. It can predict a certain outcome, definitely better than a human being, for sure. But doesn't mean that it applies for each and every case, at each and every diagnosis, at each and every time, right? Will we reach that point of singularity? I don't know. I cannot predict this future, and I'm not an AI engineer, so I cannot dwell into that. But I have seen AI use cases that have been done in healthcare that are promising, right? Faster, for example, diabetes detection and diagnosis. Faster or early detection mechanism or algorithm for sepsis in ICUs, for example. That helps, and that saves a lot of money. That saves a lot of lives. Way more important than money, right? These use cases can be, implemented, deployed in our local settings, given the variations that we have in our populations. But eventually, we'll get there, right? So I'm definitely defeating the argument that it will replace positions. In fact, I believe that it will create new roles. It will create new markets. It will make people like me work, because it's not clinical, right? Because now I'm working on AI and machine learning with one of the entities, with one of the entities that are regulating AI. I'm not going to say the name of the entity. Actually,
My my follow-up was with regards to this.
خلصنا؟
I don't know. What would you say career-wise, working with, I guess, AI engineers or developers or that? What kind of career-wise, what would you say positions play that kind of development of models or solutions that
So the question is, what can physicians learn from AI, or how they can have input to AI?
more like in developing the models and
Right.
solutions for AI.
Okay. Again, physicians are not or should not be expected to develop models or to program enterprise architecture for AI, for example. They shouldn't do that, right? What they should do is, first of all, understand how AI works, understand how AI helps them, and understand how they can modify a certain algorithm to reach to the outcome they're interested, right? If I deploy an algorithm, for example, from the University of Nebraska in the US, right, and it was successful with a high detection rate with 96% accuracy, it wouldn't help if I bring it on and deploy it in Saudi Arabia without giving the local considerations to put it in context with the model deployment. So the physicians are going to have more responsibility to localize these models, to try them, be bold with them, and make decisions out of them. As long as they don't harm the patient, for example, because otherwise it's going to be an experimental stuff that they need to be further regulated down there. But I mean, if you have a proven use case, then why not? Okay. As long as you, again, understand how it works and how it benefits your patients and how it can basically make your job more efficient and more effective, right? I'm not gonna tell to Dr. Karim, for example, go and learn how to model, or go and learn how to build, how to deploy an algorithm in an EMR system. That's just not wise, right? يعطيكم العافية جميعا. I think we passed the time. I apologize. I'm definitely sure that we will follow up on these questions and these conversations. Please reach out to me again, and I look forward to meeting you soon, inshallah. Thank you. Hey. عشان بس ادي الوقت. لا معك بسمعك كريم. الله يجزاهم خير. Rakan, I know most of these people. Rakan, I know. Thank you guys. Appreciate it. Dallas again is my colleague. Totally my partner in crime. Thank you guys. انزل ممكن احسن لو نزلت.
السلام عليكم.